MBR logistics. At this moment, we have about 90 folks participating, and we met in a planning session with some variety of stakeholder organizations last Friday, and the suggestion from those groups was that we really begin with some basic information as a point of departure and inform you today about topics on which you will be hearing more in the days and weeks to come. So the topics that I'm planning to cover today, as soon as I can figure out how to advance this, are listed on the agenda slide here. I will go through each of these in turn, and there will be an opportunity toward the end of the hour for you to enter through the computer questions or concerns. If I'm not able to respond to the questions today, we will make sure that we are able to cover those in future communication from the department. So here on this slide, we have a pie chart that illustrates the distribution of the $47.5 million for fiscal year 15. Happy New Year, by the way. And I will be walking through these. Starting with SAPT. In July, we are this month kicking off our cash realignment process, whereby we will elongate the federal fiscal year grant for substance abuse prevention and treatment over 6 quarters instead of the traditional 4 quarters, so that we can catch up with the timing of when the cash actually is deposited, typically in the state system. And this is going to lead to some cash management challenges for the field for this fiscal year. And we've discussed this at length. We had some communication that was shared in November and then again in March on this topic. And within the next few days, you should expect to see detailed information for the SAPT block grant as well as mental health block grant and other allocations from the department. But I just wanted to share this morning how the MBR actually affects the SAPT block grant payments that we will anticipate this year. We, in the MBR, had 2 items related to SAPT. From the 507 line item, which is the $47.5 million that I'm discussing this morning, we set aside $1.4 million additional for the Women's Treatment Network. And this would allow providers that are direct or pass-through to receive some augmentation relative to what they will be receiving through the SAPT block grant this year. And that is in an effort to kind of blunt the impact of the cash alignment for those groups. Similarly, we have identified within the 507 line item $1.5 million additional for prevention providers that are direct funded or pass-through funded entities. On top of that, we learned that the SAPT award for this coming year will be $1.3 million higher than last year. And so we are going to be using these additional funds to supplement other pass-through and direct providers who are not prevention providers and are not members of the Women's Treatment Network. For example, TASC, SAMI, Circle for Recovery, etc. And again, we will be sharing detailed information here on that within the next few days. So the results of these augmentations to our cash alignment strategy are listed on this slide. The direct and pass-through prevention grant providers will be funded at approximately 100% of fiscal 14. And also the women's pass-through, or excuse me, the Women's Treatment Network providers, while they had the additional resources, there's still about a $2.3 million gap in the aggregate for individuals who are, or for providers who are receiving these, the SAPT resources. And then the board allocation gap remains the same as what we published in November, and this is because the MBR augmentations just spoke to the directs and the pass-throughs, but did not address the allocations. I'm getting a number of emails or notes here on this webinar saying that people are trying to enter the webinar and it's reached capacity. So if you are aware of anyone who's trying to get in, I believe we're taping this, And so we'll make it available on our website subsequent to this presentation. Okay. So I'm going to move on now to prevention. And for prevention, there are 4 major uses of the $5 million that is being designated in the MBR. $2 million of that goes for a statewide student survey, and then $3 million will be arrayed across community coalitions, evidence-based prevention investments, and youth-led prevention. And so what I'm going to do here in these next few slides is really just talk through some of the general parameters, and then I will suggest very strongly that if you are not signed up for our e-news now, that will be the way that we'll be conveying information when we actually have releases for some of these competitive opportunities. So make sure you're signed up. Let's see. So I want to start first talking about the coalitions of excellence. We have quite a few community-based coalitions in Ohio, and we want to invest some of the resources in the MBR to assist to increase the sophistication and hopefully establish some new coalitions, particularly those that are seeking to implement the strategic prevention framework and evidence-based practices or support those in their communities. So the Coalition for Excellence resources could really be related to what the community needs in terms of training, technical assistance, peer coaching, and you can see here in the third bullet a list of examples. This is not an exhaustive list, but a list of examples that might be logical resource uses as folks are submitting proposals. And we think that we would be able to provide resource to approximately 20 coalitions, although that would be somewhat fluid. Moving on now to evidence-based practices, particularly since we have consolidated a year and a day ago the former departments of ODATIS and mental health, there has been increased focus for our entire system on the use of evidence-based practices for prevention services. And you can see here that in calendar years 11, 12, and 13, our evidence-based prevention utilization as a system has been reported to increase somewhat, but we're still only not quite a third of all of our prevention programming is evidence-based. And so we would like to move up more toward the 50% mark, if not exceed that. And so we are, as you can see here, there are only 5 states that have a lower evidence-based prevention percentage than Ohio. And so we're hoping that by setting aside some resources for evidence-based practices, individual communities or communities that are partnering could come together to provide some training and bring in these practices that could then be implemented in their communities. Third, I want to talk about the Ohio Youth-Led Prevention Network. And this infusion specific to prevention is designed to increase the number of youth-led activities around our state. The last time that the Center for Substance Abuse Prevention visited Ohio, they recommended that we implement a youth peer prevention certification. And so that's an option for folks to consider. But we really just want to put more of an emphasis on building resiliency and confidence and networking among our youth who are leading a positive role models throughout the state. And so we want to use some resources to make investments there. These could be new or established student groups in middle school or high school, and the uses could be focused on a training, technical assistance, peer coaching, or some combination thereof. We continue to support Start Talking. It is not necessary to have Start Talking underway in a community in order to apply for these specific youth-led prevention network dollars, but we are encouraging that communities consider using Start Talking as one of the tools in the toolkit locally. So I just threw a lot of information at you as far as these 3 categories. we are going to be queuing some requests for proposals over the next few months. You'll see these are numbered 4, 5, and 6. The survey about which I will speak in a moment actually relates to RFPs 1, 2, and 3. But we will do a release for training and technical assistance for all of the areas in July, hopefully make an award in August. We will have an evaluation and planning component, and that will be over July and August as well. And then we will have another RFP later in the award as we get into the fall. So again, make sure that you're signed up for our monthly newsletters, and you would thereby immediately get the news nows as we are making announcements as far as requests for proposals. You will make sure that you're connected to those opportunities. I want to talk for a moment now about the prevention survey. The SAMHSA requires the states to provide outcomes, and you can see here the actual language from SAMHSA from 2012. We do not have a comprehensive statewide survey in Ohio, and so our progress on this front has been somewhat complicated to date. There are a lot of surveys out there locally, and we are aware of at least 59 survey efforts across our 88 counties, and you can see all of the different municipalities. They're not all county specific. Some might be townships or villages as of last year. And so it's a little bit scattershot just because it has been very, I guess, organic over time. Ohio's drug-free community coalitions are required to survey their jurisdictions as a caveat to receiving the federal resources, and this map shows where those coalitions are located. I believe that the surveys for drug-free community coalitions are on a 2-year cycle, and so we would attempt to get in queue so that these coalitions could, at their option, use the statewide survey in lieu of spending separately for their own. This may or may not work out depending on local circumstances, but what we want to do is have some logistical planning sessions where people will be able to ask questions, raise concerns, and actually work through some of these logistics so that this can be as value-added as possible to all of Ohio if communities elect to use the statewide survey at their option. This map here shows just generally where we are aware that counties have some kind of health survey data being collected. And you can see at the bottom the list of the organizations that are collecting those information elements. So again, many different things underway. We are not attempting with this survey to replace anything that is currently underway by requiring anybody to use it, but rather we're saying if it works for you, it might be an opportunity to use the statewide survey that will have county-specific information and then shift your current investment into something else that would be meaningful for you. So a lot of work to do on this survey. Our target date to actually have it rolled out to the field is a year from this fall, 2015. And so this slide just shows some of the milestones that we are anticipating between now and when the survey would be available. There is a current Interagency Prevention Partners group that meets, and so we will be vetting the general approach with that group and also with the interested community partners. And again, we really want to hear what sorts of logistical questions and concerns folks have in the field, because we want to make sure that we're incorporating those concerns into what we hope will be the most viable model possible for implementation. So you can see here the technical RFPs that would be, what survey instrument would be using, sample development, IRB, et cetera. Obviously, this is not an RFP that a general community coalition would probably be eligible to respond to, but this would be more of a research-based organization. The second RFP is related to actually cultivating relationships with schools and coalitions to assess interest in using the survey and actually enabling access to the sample of students ultimately who would be surveyed. And then the third RFP is related to the data capture, the database, and reporting. And Ohio will own this information related to the survey. So I know that there's interest on the part of other state agencies, and we want to make it available, to communities to use in a way that would be most meaningful for them. So you will be hearing more about this and more about how to raise your logistical questions that you may have related to the statewide survey. Want to move on now to recovery housing, and there are actually 2 earmarks related to this in the MBR. But before I get to that, I just wanted to share the definition that we're using for recovery housing. It's defined as housing for individuals who are recovering from a drug addiction that provides an alcohol and drug-free living environment, peer support, assistance with obtaining services, drug addiction services, and other drug addiction recovery assistance where the length of stay is not limited to a specific duration. We recognize that there are recovery residences around the state that are not officially connected with the public system, and there are some established partnerships underway today. We anticipate we will be building our capacity through the use of the 2 earmarks in the bill. So specifically, there's a $5 million earmark in the 507 line item. So this is an earmark of the $47.5 million. And then there's also, as part of the MBR, a $5 million capital earmark. And you may recall that several months ago, the General Assembly passed and the governor signed the state's 2-year capital bill. We had $15 million appropriated for community capital for our system, mental health and addiction services. And this is the first time post-consolidation that we will have the ability to use capital dollars for bricks and mortar AOD-related projects. And so we're really excited about that. But then the MBR took a step further and actually earmarked $5 million for recovery residences. So the purpose of these 2 earmarks together is to increase capacity to provide recovery housing. And so I'll be talking about that in a second. Specific to the capital budget, though, our department requested that boards submit by July 11th their #1 priority for capital funding. And really, remember, we had $15 million in appropriation for capital in general, and we were not aware at that point that there was going to be an earmark related to recovery housing. We had about $55 million in requests from boards related to capital in general last fall when we queried the boards on their bricks and mortar needs. And this includes recovery housing. It also includes permanent supportive housing for individuals who are living with mental illness, peer support, capital-related projects, maybe some residential or other licensed space. And so as we prepared to kind of queue up our work plan around the broader capital budget, we asked boards to sort of provide us with information about their first project that they would have ready in the queue. So a site has been identified, financing has been identified, maybe with partnership through the Ohio Housing Finance Agency or Federal Home Loan Bank or other things. And so we're trying now to actually queue our use of the appropriation based on the projects that are ready to go. And so I want to emphasize here that the kind of first priority, most ready project that will be submitted by the boards next Friday is not, sort of the first and last bite at the apple, but rather we're trying to get lined up internally for which projects are actionable first so that we can actually, get going to use the $15 million in resource that is appropriated for capital in the aggregate. So our capital dollars are specific to bricks and mortar types of things. And we are going to follow our existing capital processes. There are 3 boards, the ADIS-only boards, that have not had a long-standing history with the department as it relates to capital. We have reached out and offered technical assistance to those 3 boards, so we are confident that all 53 boards will be ready to hit the ground running as it relates to use of the capital dollars. But we have asked boards to supply their priority projects by July 11th. But that can be revised at any time. If maybe a project is submitted and then something falls through with the financing, another one can be submitted, or if there is sort of breaking news in the community and there is a donation of a perfect site to do permanent supportive housing or recovery housing or something else, the board can at any point amend their projects in the work plan with us. So for the earmark, though, for the recovery housing, we have 2 years to expend these dollars because it's a biennial capital budget. And we will be, as I said, taking amendments to board proposals throughout that period. But it's, we are seeking to fund the projects that are actionable. And so when something is ready to go, then folks, know to come and talk with us about that. We are to target the recovery residence earmark in the capital bill to underserved areas related to recovery housing or areas without any recovery housing. And obviously, we want to put an emphasis on those that are actually ready to proceed now. And we're going to be looking for a 50% local match. And this is consistent with our existing capital process. So this doesn't have to be match money from the board, but if there is match money that comes from another source, that's fine as well. And if anyone's interested in more information, I would encourage you to contact our capital office, and we can make sure your questions are answered. So now let's flip over to the recovery housing earmark in the general revenue fund. We have a $5 million set aside there, and recognizing that we now have 2 pools of resource, one capital and one operating, that can be used to support the capacity expansion for recovery residences, we wanted to be a little more flexible with the use of the GRF. They could be used for, these dollars could be used for a straight purchase, like bricks and mortar purchase, or a renovation that is sort of capital in nature, because you can use, by state law, you can use operating dollars for capital, but you can't go the other way and use capital dollars for operating. So it could be used for sort of a bricks and mortar purchase, or it can be used for direct recovery housing operation support. And this might be the first year to furnish a residence that's been recently donated or acquired. It could be actually funding some limited staffing support there. We are not establishing a per diem expectation, but rather we want communities to tell us what it is that they need. And we will sort of approach it that way. So we will have a funding announcement that is formally made available with a due date, and then we will do a notification of award. Again, we're giving priority to projects in underserved counties or counties that don't have recovery housing. Now, I know that there are 53 ways that rationale could be made quite legitimately that a county is underserved in this respect, and so I want to share with you here a map that shows where we know we have some kind of capacity, whether it's licensed, halfway house, or recovery housing. And there are the areas that are just white on this map. There may be maybe faith-based recovery residences that are operating outside of the public system. We don't know about them, but I think those areas, we have probably the greatest degree of information after consulting with the Women's Network, the boards, Recovery Housing Listserv, and our certification database that, there really doesn't appear to be anything available in those white communities. Also, the second map here is a county that is without recovery housing. So this moves aside the license settings and the halfway homes and just focuses on those communities that we know have some definition of recovery housing, as it was stated earlier in this presentation. So I know folks have a lot of questions about recovery housing. We intend to do some kind of seminar, maybe webinar later this month that goes into more detail about general parameters, because I recognize you probably have a lot of questions right now, and we also recognize that there are a number of logistical issues that we still need to resolve, and so we're committed to doing so. We are keeping an open list of items related to recovery housing that need to be addressed either in rule or policy, and we are developing a work plan to actually get through all of those so that we can make sure that the funds are able to be used to expand capacity as soon as possible. I want to switch now to another earmark, and this is the one that says the remainder of the foregoing appropriation in the 507 line item shall be invested in addiction and mental health recovery supports with an emphasis on crisis and housing. And this is the sort of the last earmark after all other earmarks have been identified. And I know I still have a few more to talk about, but I want to spend just a few minutes on this recovery supports with an emphasis on crisis and housing. The earmark says an amount up to $24.1 million. Want to remind you that for the women's treatment providers, I've talked about using $1.5 million to help sort of blunt the impact of the SAPT cash alignment for those folks. Again, they're providing housing directly as a part of their residential services, and so we've taken that off the top. We've also taken $2.5 million off the top of this amount after discussions with the board association, because in fiscal year 14, we had $2.5 million set aside in this line item to fund alcohol and other drug hotspots. And this was post-consolidation and an augmentation to the mental health hotspot demonstrations that were underway. And so there was not a specific earmark related to the AOD hotspots for fiscal 15, but we were committed to continuing the mental health hotspots and wanted to make sure that we had consistent treatment and were able to continue the AOD hotspots. And so we've taken that amount off the top as well. So that leaves $20.1 million that's remaining related to this specific earmark. And so back in March, we did a webinar on the governor's MBR proposal as introduced, and we are going to follow largely the same approach that I articulated on that webinar. We have $20.1 million at this point, and we are identifying a per capita amount by region of the state. And the regions are directly related to our hospital collaborative areas. And so in some respects, this is somewhat of an arbitrary map, but we needed to identify some regions, and with the hospital collaborative, there is ongoing conversation with the boards that are engaged with a specific hospital. And so we thought that the collaborative region that we had for the hospitals would be a logical one to use here. So you can see by region the portion of the $20.1 million that is available for investment. And if you are interested and unfamiliar with the map of the catchment areas, we can certainly make that available when we post this webinar. But just to let you know, that's the approach that we took. So we have met with the boards to talk about questions that they had about this overall approach. We want to focus on information that has been identified as gap areas or areas of need for fiscal 15 related to risks to the local system, to items that are identified in the community plan. And we're also soliciting suggestions, or we will be soliciting suggestions via our broader stakeholder network about current system gaps. And so within the next few days to a week or so, we will be making available a SurveyMonkey tool to the field through our News Now, where we pose some questions that actually have been vetted by a smaller group of stakeholders. And we're asking for suggestions that could be applied either to state fiscal year 15 as we're working through the disposition of this $20.1 million, or something that we could consider for application in fiscal year 16 and 17, because concurrent to the MBR implementation, we are also doing budget planning for the next biennium. And so if you submit a suggestion or a proposal, there's no guarantee that we will accept it, but we will definitely review it and use that as part of the planning process. So expect to see, as a next step there, expect to see the public survey within the next week or so, and we will have further communication regarding procedural steps there. Want to change over to another earmark now, and this is the residential state supplement. You are probably aware that our department, actually 2 years ago, yesterday, took over the licensure of adult care facilities, adult foster homes, and other types of settings that were 16 beds or less. And we have been working to help augment the operator's ability to deliver quality services in those licensed settings. As a part of this, we undertook a study that was required by the current operating budget bill. But before I go there, I just want to kind of remind everyone what RSS is. And so this slide has the criteria for enrollment into RSS. The allowable fees have not changed for a very considerable amount of time, and you can see them arrayed here on this table. And so as we undertook the RSS review last July through December, there was a lot of discussion about potential program changes. Today, the only way that you can enroll in RSS is if you are coming from a nursing facility. Funding attrited over a long period of time before the program regulation was moved into this department, and as a result, the enrollment is open only to people who are moving into a less restrictive setting, i.e. from a nursing home into a community-based licensed setting. We want to put emphasis on serving individuals in homes that serve 16 people or less. The Department of Health actually licenses the assisted living sites that are 17 or more, and the focus of our earmark implementation and really the recommendations of the study group in general are on those individuals who are living in settings 16 or less. There was also interest in increasing the allowable fees and the benefits. So we are working to establish a proposal or implementation steps related to RSS, and you will be hearing more about that one as well. But we would see this as an opportunity to, number one, augment somewhat the rates that are paid to existing providers, because there has not been a change in a very long time, and also extend the benefits to many more Ohioans around the state, not just those who are coming out of a nursing facility setting. So look for more information on that. And then finally, I think the last earmark that I have here today to talk with you about is related to specialty dockets. There is an earmark in the final version of the MBR that sets aside $4.4 million this year to defray a portion of the annual payroll cost associated with a court's employment of a specialty docket staff member. And you can see on this slide that there are a variety of courts that are eligible to receive this benefit. So we'll just talk for a second about that. We will be reaching out to contact each court that may be eligible for these resources within the next days or maybe the next week, and with the goal of actually providing the funding to them by mid-September. It is possible that as additional courts become certified by the Supreme Court as a specialty docket, they would be able to seek funding, upon their eligibility. this is, obviously we just had the Judicial Symposium earlier this week where we talked about the benefits and, candidly, the successes of many of the specialty dockets in Ohio as it relates to individuals who are addicted to opiates or other drugs. And this is an opportunity to expand some capacity of the courts to continue to serve or serve more individuals. So courts of common pleas, municipal courts, or juvenile or family courts that currently have or anticipate having a certified drug court or recovery court are eligible to participate in receiving some of these dollars. And the specialty docket staff have to be trained in alcohol and other drug addiction. They need to understand how to engage a person in treatment and understand connections to other systems in addition to the behavioral health system. These dollars are not for treatment per se, but they are to employ people in the courts who would be able to work effectively with the overall treatment system in that community. And this slide here actually contains the funding methodology, and this is straight from the bill, from the legislation, and it's very strict, so there's not opportunity to deviate. This is one-time funding for fiscal 15, although we know that there's legislative interest in continuing this. That hasn't actually occurred in a budget bill beyond fiscal 15 at this point. It will pay the compensation and fringe benefits, or the total payroll cost of a full-time equivalent employee or a combination of employees that would staff the docket. And it would pay the lesser of basically it would pay a cost not to exceed $50,700. And so we will be sending more information directly to the courts, not only the judges, but the court administrator, and we will be following up with calls if we have any concern that this information has not been received by the courts or we haven't heard back. So a couple of other things related to the MBR items related to our system. There was legislation that established a more specific requirements for a continuum of care, and those were originated in House Bill 369 last December. They were consolidated into the as-passed version of the MBR. We will be working with the system as a whole in the weeks and months ahead to talk about those requirements and the implementation of those requirements. Our emphasis immediately out of the chute, though, is the implementation of the earmarks that I discussed today, so that we will be able to ensure that we have the resources flowing to the system as soon as possible. Related to the continuum of care, though, much of the major provisions of the language take effect in 2 years, and so we will be doing planning at this, over the course of the summer and into the fall. Many of you are aware that we are going to be undertaking strategic planning for the department, and that will be an opportunity as well to kind of meld those two discussions as we go forward this year. So we are, as you're aware, very accessible via social media, but what I really want to call your attention to here is our website. In the center of this slide, if you have not signed up for our e-news listserv, please make sure that you do so, because as we have educational opportunities available or meetings related to all of the topics that I highlighted briefly today, that will be our major venue to announce those discussions or those learning opportunities. So please make sure that you're connected. You go to the main page of our site and just scroll down to the bottom, and you will have the opportunity to sign up. So that concludes my remarks for today. And at this point, I believe I've got some questions. Let's see if I can. We are now maxed out at 101 attendees, and so please remember to let folks know that we will be publishing this on our website subsequent to the webinar today, so people who weren't able to participate can review the information. The first question that I have is, what is the definition or age range of youth? I would imagine that this is related to the youth-led prevention efforts that I discussed earlier in the presentation, although, Nancy, if you want to, if that's not the focus of your question, certainly send another question in to let me know. But the focus would be middle and high school, but I think that there is opportunity to think about transition age youth and you know, as a part of the proposal as well. So that's something that we can clarify in future communication related to the prevention services. Next question is from Wendy. What is meant by health survey data? This is actually proposed to be a survey of young people that would have samples from each county that could be rolled up to provide aggregate statewide information about the risk behaviors of youth and basically a way for us to direct our future prevention programming and kind of baseline our progress related to outcomes of that programming as we go forward. And so I hope that answers your question, but if not, we can provide more information as we go forward. Next question, regarding the MBR recovery supports with an emphasis on crisis and housing, would this be a recovery coach salary to work with recovery housing residents? Could you give some general ideas? This is from Steve. This is actually technically possible to use some of the $20.1 million earmark to do some community-specific or regional planning or investment related to recovery residences. We also have the $5 million set aside, which is a separate earmark for recovery residences. And to the extent that related to that $5 million earmark, there is a proposal for the first year of operating funds. That could also cover peer services in the home. Maybe you've got a 4-bed home where it's anticipated that 2 of the individuals would be working at any given time and thus could contribute to the cost of the rent. Maybe the other 2 are a little earlier in their recovery, perhaps just came from a residential setting, and they're not yet connected with employment. And so some of the operating expenses in that scenario might be to cover the cost of the rent because, you know, 2 of the individuals aren't working and thus, you know, there isn't a contribution from 100% of the residents to make the math work. So, Steve, I think that your question could be applied to either an operating proposal related to the $5 million earmark or potentially a sort of a similar proposal that could come out of the $20.1 million. Let's see. The next one is a thank you for the webinar, and please keep us abreast of future webinars as we go forward. Again, I would just remind you there, Joseph, to please make sure that you're connected to our website because that's where we will be announcing the future webinars, and also it was good to see you at the conference this week. Let's see, how soon will boards have allocation amounts to complete planning to identify gaps created by the changes and plans for continuation of current crisis, housing, and recovery support services? I believe our plan is to have that information available to the field by the end of next week. Yes. So if it's not available today or tomorrow, it will be available sometime next week. I've been out of the office for 2 days at the conference, and so I do not yet have an update on that specific question, but we had planned that as soon as possible, but not later than next Friday, we would have that available to the field. Next questions. Are there any plans by the department to utilize the appropriation for recovery housing to address the loss of recovery housing capacity resulting from the discontinuation of the HER grant at the end of September? I think that that is a topic that we could certainly explore because the loss of capacity that has been built, you know, is still a backtracking of capacity. So let me connect with our housing team and we can get more clarity on that. But I don't think that that's certainly off the table for consideration. Next question. Given the significant onset of both substance abuse and mental illness are in adolescents, how will the department assure that a proportional amount of resources will be directed to adolescents and their families? And this question is from Patrick Canary. This, I think, certainly with respect to the, I'm assuming that you're focused on some of the more treatment dollars because there is obviously a very significant youth-focused prevention component to that earmark. I think that that's something that we need to make sure we have some safeguards assured. I've not personally been connected with detailed conversations on that front, but I think that that's an excellent point that you make, and we can incorporate that in our process. I don't have a specific answer for you today. We have had some general discussion on that front, but I will add that to the list of things that we need to make sure we clarify. So that has exhausted the questions that we have today. I appreciate your attention, and we will get this webinar and related materials, including a map of the hospital catchment areas, posted as soon as possible. And thank you for your participation.